Good afternoon. My name is Dr. Martin O'Malley. I'm an orthopedic surgeon. I practice at the Hospital for Special Surgery in New York. And also I'm a team physician for the Brooklyn Nets, the New York Giants, and for USA Basketball. I'm going to spend a few minutes talking about our experience with the Shockwave technology from TRT Technologies. We first purchased our machine back in 2014, so we've had them for about 8 years. We started with one, but because the demand became so great, we had to purchase a second one, and we're quite happy with our results. I practice with 2 other orthopedic surgeons. We are all team doctors for different professional teams, and this is our office, and I'll show you our machine. So we go down to our office, and this is the most common thing that we use on a daily basis for non-operative care. It is the Shockwave technology. The machine is pretty compact. It's easy to use. We can dial up the power on it, on the millijoules. It's the medical assistants or the PAs are the ones who actually perform the Shockwave. We indicate the patients. They come back off and on in the operating room. The patients will have a whole list of shockwaves. We have shockwaves today. We have 5 shockwaves or 6 shockwaves. Pretty easy to use. A foot pedal, and you can dial the intensity to whatever indication you have. We've had great experience with it. We see a lot of plantar fasciitis, a lot of Achilles tendonitis. Those are our 2 main indications for it. But any of the tendinopathy, it's very effective for. Also, because we do foot and ankle, we have some diabetic patients. We have diabetic wounds, and actually it's approved by the FDA for diabetic wounds. We've had some really remarkable studies for wound healing. You have to put a sterile cover over it, but in order to recruit stem cells and form new stem cells, the TRT technology is really good. The biggest advantage is really the Shockwave technology. Because it's soft wave, it's a more diffuse wave, the patients can do it without anesthesia. So we often have 2 probes. We'll have one, the unfocused soft wave probe, which we use the majority of the time, and we'll have a second probe which is more of a focused probe, which we use for more bone indications. So if a patient has a 5th metatarsal, it's a slow healing of a 5th metatarsal, or a tibia stress fracture. For the bone indications, we use the more focused probe. Even though there's a CPT code for it, insurance doesn't reimburse for it, but we have no problem getting the patients to pay for it. The patients are very willing to pay to get better, and especially for technology that works. We published a study back in, I think it was 2020, in the Journal of Foot and Ankle Surgery, using soft wave, unfocused technology, medium intensity for plantar fasciitis, and we had 85% success rate. So we're very happy with it. It's really part of our daily practice here at Sports Foot and Ankle. And I'm not sure how you can practice in 2022 as a sports medicine physician without using some sort of shockwave technology. It has a tremendous number of randomized control studies showing the technology works. And compared to the other devices, I think the TRT device is the most user-friendly and the most effective. Thank you.